Some good news first from the First Minister and Deputy First Minister of Northern Ireland. They indicated today that levels of infections in Northern Ireland are slowly starting to come down, heading in the right direction. The hope, of course, is that that will eventually translate through into lower levels of admissions in hospitals like here at Craigavon Area Hospital. And I have to say, having spent 3 days with staff here, they are in desperate need of some respite when it comes to that front. We first visited this hospital about 9 months ago during the first wave last year, and back then staff, they were stretched, yes, but coping nonetheless. But that was before a second wave and, of course, a third wave just after Christmas, which sent admissions here absolutely rocketing. Over the last 3 days, senior staff have been remarkably candid with us, I should say, about the extent to which this hospital suffered, and really spoke about a system and a hospital that at points was teetering on the edge of collapse. This is 2 North, one of the COVID wards at Craigavon Area Hospital, County Armagh. If you're here, you're either on your way to intensive care or you've just left. Space at such a premium, as soon as one patient leaves, another arrives. Victoria Burnett is the nurse in charge. We first met last April during the first wave of the pandemic. Was there one moment over the last 12 months that where you felt like giving up yourself?
Yes.
What was that moment?
There's been many.
The last spike in infections just 2 weeks ago dwarfed the others. It was a direct result of easing restrictions during Christmas.
You're doing really well, all right?
There were so many admissions that half of all patients in Craigavon Hospital were here with COVID. At one stage, Victoria and the hospital were so overwhelmed that 80 patients had to be diverted to other hospitals, something which had never happened before. Tell us what it was like.
Hell. For a lot of it. And we have all struggled, and I struggle. It's really difficult. It's really difficult to have all of those patients pass, even though we have fought so hard to save them.
There's too many people going out through the door that have passed away, and it's nothing else but COVID.
Francis Vallely and John Donaldson on 2 North are neighbours from rural Armagh, both brought back from the brink by the staff here. Now, as part of their recovery, walking aid races.
1 to get ready, 2 to get steady, 3 to go, Francis.
A nice steady little pace going along.
As John pulls ahead, the corridor stages a rehearsal for the journey home.
Heading towards Market Hill.
2 neighbours heading home probably tomorrow or the next day.
And then up towards Whitecross and Hamilton.
The place names of some of the worst affected areas by COVID in the UK. One of many reasons why this area is close to the border with the Republic and mirrors high infection rates there in recent weeks. And these are the people from the worst affected places in Northern Ireland. The COVID intensive care unit has doubled in size since the last time we were here. Also, patients are younger and sicker here now. Doctors told us that 60% of COVID-positive patients in the hospital now present with the new variant of the disease. What's striking about ICU here in Craigavon compared to the last time we were here is the size of it now. It's double the capacity, basically. There's double the amount of staff at patients' bedside, there's double the amount of patients and double the amount of machinery helping people to breathe, helping people to survive. In other words, COVID is devouring this hospital's capacity to treat other conditions. Outside ICU, a senior consultant's brutally honest assessment of what's happening.
Well, we're not doing cancer surgery for likes of bowel cancer, kidney cancer. We're severely hampered in our ability to do breast cancer. On other major orthopaedic procedures as well, we're not able to do.
So what's happened to those people?
Well, then people, we're doing our best to try to treat these patients on a regional basis by helping each other across the province, and we use other trusts to help us out, but we're not meeting the need of the patients of Northern Ireland. There are patients who are not getting treated in a timely manner.
Even before COVID, the health service in Northern Ireland was struggling. Then the pandemic. During the third wave of infections, the Trust's boss and her team were staring into the abyss. And this is what that looks like.
I've worked in the health service for 30 years, right? And I think it probably was one of the worst days, I think, when we came... Oh, sorry.
To what extent has this crisis exposed, like, the pre-existing frailty of healthcare in Northern Ireland?
On every level, I think. I think in terms of infrastructure, the age of buildings, the staff shortages, I think it has exposed a lot of that. I think what it has, though, highlighted as well is how determined, I think, our health service staff are to actually get us through the other end of this.
A resilient but exhausted workforce has meant absentee rates have doubled at the hospital. And at 2 North, Victoria's ward, 6 nurses have left since November.
I'm in post 3 years and I had had no previous resignations in that time. And I lost really good nurses, really good. But they just couldn't take it anymore.
Hello, long I do good.
Brian Craney almost didn't make it. So everyone in the family bubble back home wants to talk to him on the video call.
That's the oldest grandchild.
As you'd expect, they're not allowed to come to see Brian. But his daughter Charlene wants people to see what COVID has done to their family.
I don't think people really, realise how serious this is, and they really need to see what's going on inside them wards. Or maybe some people, would need to go down and do a shift, or do what them nurses are doing.
Hey, get out of here.
We know you will.
Sooner or later.
We know you're over. We're waiting for you.
3 weeks, 3 months, I don't care. I get out.
Brian has a way to go yet, but these calls are part of his recovery.
We love you, Brad, okay?
What the fuck is it?
I love you, Brad. Good man, good man.
There were a lot of tears during our visit to Craigavon Area Hospital, but also tears wiped away by patients, by families, by staff.